Okay, I just made a very brief video about sort of an overview of what happened when I went in to see a doctor post my psychotic episode in Ontario recently. So one thing I mentioned at the very end of the video, which I think I should address now while it's kind of freshly in my mind, despite the fact that it's fairly unstructured in my mind, but fuck it, was the different types of questions that can be asked. Now, I sort of separated it into two. First being very logical, stationary, clear-cut questions involving answers that are, for the most part, simple facts. So that's stuff like, like I mentioned before, like how many hours are you sleeping? Are you eating? Are you being social? Or can you do your job? Or how are you able to do school? Can you focus? Do you have a family history of mental illness? When did you first begin having symptoms? All this kind of stuff that's like very, one answer, like, when did you start having symptoms? 2 weeks ago. You could just answer like, but then those are the types of questions that usually occur as a result of speaking to specifically a psychiatrist. Now, when I was assessed or whatever, I guess, this time I saw a psychiatrist, a mental health nurse, and a psychologist. 3 people in the same room, an environment which I had never experienced before and irked me. Of course it irked me. I was already paranoid, so it didn't really help. So anyway, the questions the psychologist asked were more follow-up questions, I think. Like, for example, he asked the psychiatrist asked me if I was socializing, and then the psychologist asked, and I said yes, with friends. Obviously, I'm here where I live, so I of course have access to people I know, who I speak with and hang out with. And he sort of tried to be a little bit more specific about that and sort of just get at what kind of friends we're talking about, whether, acquaintances or, just close friends, because those two things are completely distinct. However, the psychiatrist didn't ask that. He only asked the initial question. So that was interesting. Now, beyond that, the mental health nurse, she was more along the lines of still asking about medication and straightforward questions. But anyway, I think it's very valuable to be able to have more than one professional in the room at the time, because they're able to sort of not necessarily ask gray questions or questions that don't have a very clear and distinct answer, but questions that are fairly kind of open-ended, and just in the response you are able to gauge someone's mindset, with someone's mood, I suppose, really sort of psychologically how it's affecting the person's thought process by viewing whether or not they're actually, because a common symptom of psychosis is something that's called disordered thinking. So it's pretty clear, you can tell if someone's thinking in a distorted, scattered manner if you have them answer a question that involves a significant amount of explanation. So, I know I'm in Canada, British Columbia. Now, I know this is a part of the system here. I know that in the UK there's something called CAMS. I really don't know anything about it, so if anyone could enlighten me, I would really appreciate it. Now, in the States, I have no idea how it's done. So also can enlighten me. But anyway, this is how it is. This is my situation right now, and I think that the multifaceted approach is far superior to the experiences that I've had in the past.